MyStop Sierra Leone joins MyStops International, the global organization, to celebrate 40 years of being in existence and of unwavering commitment of women having children by choice and not by chance. In an engagement with members of the press, the country director of MyStop Sierra Leone, Informa Obi, noted that they are proud of their role in delivering MyStop's international mission of children by choice and not by chance. He then made mention of the key role MyStop Sierra Leone played, especially during the Ebola outbreak in the country, in delivering their reproductive health care services, delivering babies, and giving the best care and support to women right across the country.
Were it not for MyStops in the face of Ebola, in the face of EVD, the burden of teenage pregnancy that they experienced would have been more. But thanks to the work of enabling women to have children by choice and not chance. So we're in all districts. We provide a full range of services that includes contraception, family planning services. We also provide uniquely in Sierra Leone safe motherhood services. Every month we are fortunate to receive funding from the British government, and we are fortunate to be implementing the President's plan, which a lot of us in the media do know, the free healthcare initiative of Mr. President, His Excellency Michael Obama. We deliver babies, close to 1,000 babies every month through a network of partner hospitals. We also provide essential medicines for managing missed abortion and post-abortion care. We all know that we, as a country, we are still operating under an 18th century law that prohibits abortion, but we all know that women who are desperate or women who are placed in desperate situations, like that woman in Papua New Guinea who will fall pregnant because she ovulates every month and she has sex, would want to have an abortion by all means. But because abortion is not legal, people take laws into their hands and they do what they need to do. And when they're in that difficult situation, we get to help. So we currently provide post-abortion care services nationwide through our social marketing program. We make sure that a very stable, essential medicine is available to women. If you ask your friends very well, if you ask your sisters, they will tell you about their experience about the safe abortion and so on and so forth, and what work we do to save the lives of women. We have 7 million Sierra Leoneans by our population numbers. We were fortunate last year to serve 10% of the entire population of this country, women only. We served close to 800,000 women, precisely 786,210 women accessed MyStop sites, and we deliver services to this number of women. We are humbled by that number. It's a small number, but it's a significant number because that number meant that we delivered we protected close to 360 we provided protection for 360,000 years for women not to fall pregnant. It's a very important number to us. On that day, we'll talk about what couple years of protection is.
He further stated that since they started their operations in Sierra Leone and across the world, they have specifically laid emphasis on addressing reproductive health and family planning activities. And they are introducing a new medical care for women, which came about as a result of the discovery of cervical cancer that has been diagnosed to serve as a threat to the lives of women in the coming years.
Our focus has been on reproductive health and family planning services. That is our focus. That's what we live. That's what we do. For us in Sierra Leone is to bring in what research has proven that it's going to be something bigger than HIV/AIDS. There's going to be one of the biggest killer of women with time, and that is the HPV virus, or what people will know as cervical cancer. Research and studies have shown that because of the early initiation of sex amongst young girls, and particularly in a country like Sierra Leone, where the age of sexual debut is between 8 and 9, HPV, the virus that causes cervical cancer, is going to shoot up. Now, in response to that, what we have done as a business and organization is to set up a cervical cancer screening and prevention therapy program. The program is aimed at ensuring that we screen women and girls who are vulnerable to, of course, who are already having sex and who are vulnerable to having HPV. And when they do have HPV or they do have precancerous lesion, we do treatment. So we have a program currently being we're implementing that is called the local technology, or what is globally called is the See and Treat.
Dr. Edward Mubi, Director of Programs Development at MyStop Sierra Leone, said over 99.9% of their clients are women, and however encouraged the men to make good use of the services of MyStop Sierra Leone.
What happens, what we have seen from the data we have, is that about 99.9% of the clients we get are women, and not men. So when we treat the women, the men are not treated. You know what happens? The STI comes back. So we hope you can work with us so that people will know that you can't treat one and leave the other. We want to be able to treat the men and the women. That's the challenge. We want women to be healthy. But because we are not treating the men, they are not as healthy as they can be. And even in our centers, in our clinics, we want men to be visiting our clinics because we can provide services for them as well.
It was, however, stated MyStop Sierra Leone was established in 1986 and has been in existence in Sierra Leone for over 30 years and continues to play a vital role in the organization's mission and pledge their commitment in providing more care and support to women and girls right across the country. For Star News in Freetown, Adamasila reporting.